Wrist ulnar deviation. This exercise strengthens the flexor carpi ulnaris and extensor carpi ulnaris muscles. Use the appropriate forearm position as required by the condition of your client or patient. Variation 1. Wrist ulnar deviation with forearm in neutral position. Sit upright on a chair with an armrest. You may use a side table as armrest as alternative. For better isolation of the movement, tuck your elbow near your side and bend it to 90 degrees flexion. Note on the video that the direction of the resistance should come from opposite the direction of the movement. Position the forearm in neutral. Secure the resistance band by wrapping it around your back and holding the other end with your other hand. Grab and pull the band, bringing the hand downward. Control the movement as you go back to the original position. Be mindful that the elbow joint does not engage in the activity. You may stabilize by holding down the forearm with the opposite hand if possible. Choose the right color of the band for the needed resistance. Variation 2. Wrist ulnar deviation with forearm in supinated position. Sit upright on a chair with an armrest. You may use a side table as armrest as alternative. For better isolation of the movement, tuck your elbow near your side and bend it to 90 degrees flexion. Note on the video that the direction of the resistance should come from opposite the direction of the movement. Position the forearm in supination. Secure the resistance band against the wall or sturdy surface. Grab and pull the band, bringing the hand inward. Control the movement as you go back to the original position. Be mindful that the elbow joint does not engage in the activity. You may stabilize by holding down the forearm with the opposite hand. Choose the right color of the band for the needed resistance. Variation 3. Wrist ulnar deviation with forearm in pronated position. Sit upright on a chair with an armrest. You may use a side table as armrest as alternative. For better isolation of the movement, tuck your elbow near your side and bend it to 90 degrees flexion. Note on the video that the direction of the resistance should come from opposite the direction of the movement. Position the forearm in pronation. Secure the resistance band against the wall or sturdy surface, or hold one end of the band with the opposite hand. Grab and pull the band, bringing the hand outward. Control the movement as you go back to the original position. Be mindful that the elbow joint does not engage in the activity. The opposite hand may stabilize by holding down the forearm. Choose the right color of the band for the needed resistance.